Danny Domingue. I'm a general dentist in Lafayette, Louisiana, and I've been practicing in this current location for 12 years. I actually bought the first initial intraoral scanner in the state of Louisiana 8 years ago. It was black and white, no color for intraoral scanning. Technology in 8 years has changed tremendously to what it is right now. So I've used maybe 4 different manufacturers of intraoral scanners. Every time a new scanner comes to market, there's always going to be something better, newer, faster, smaller, and better for patients. The newest scanner, the Elite, that just was released is by far the most impressive one I've ever used. Not only from the intraoral perspective, but also because they have the photogrammetry aspect, or intraoral photogrammetry aspect to use for full arch. Another thing it does is it picks up soft tissue really well. So whenever you have a long span of soft tissue, sometimes intraoral scanners get confused on pink. This one processed the scans very well. Normally we schedule a procedure 2 hours for a conversion intraoral scan. This was scheduled for an hour for a single arch today, which kind of blew the assistants away on the speed and accuracy of it. We're actually able to walk over to the lab immediately following the scan and actually see it pulled up in exocad and see how the file's transferred. Pretty impressive, right? So I used photogrammetry maybe 5 years now. I've had great success with it, love the technology. There's always that, when's that company coming out with the intraoral photogrammetry, like the iOS scanning capability with photogrammetry? That's always been like the hottest topic of soon to come. But once photogrammetry was released, it was always like the latest version of a new photogrammetry. But this newest form of intraoral photogrammetry, we've never seen anything like this before. So this is the newest one, the first one that's developed in market. Truly, technology's there. It's impressive that they were able to develop it that fast. Advantages, much easier on the dental assistants. They do a lot of the scanning for me after procedures. I don't have to think about it. They prefer that. Also the stitching. The stitching happens actually in the software. Once you scan, it'll actually auto-stitch in the software. So from your initial scan to your photogrammetry scan, bite scan, everything gets stitched so when a lab gets it, as opposed to current photogrammetry where you take your photogrammetry, you take your intraoral scans, and you have to manually stitch those somehow. This is all done in the software. I've never seen anything like it before. Really impressive. There are a lot of good scanners on the market right now. Some scanners are really, really good and accurate, but the software is not great. This one's different. The camera, the intraoral camera, is very small and very lightweight. It's easy to use for the staff. The software is very intuitive. It's not very difficult. There's no big learning curve. By far, it seems like it has the best of all worlds. The software is amazing. Once you interact with the software and see what actually, the capabilities of it, it's something that we've never thought we needed, but it's been an incredible solution to a problem that we've always had. So the Elite scanner is, so everybody wants to know, like, how fast is it? Is it affordable? What does it all come with? We've been holding back on buying an intraoral scanner for a while. There's been latest and greatest upgrade scanners, and we've had what's worked and we've kept it. And now we're jumping from an old gen iOS intraoral scanner into the shining world. We did that initially with the facial scanner, which was great, and now we're doing it with the Elite. The Elite is nice because the price point is incredibly affordable, and not only do you get a brand new intraoral scanner that's accurate with good software, but you also get a intraoral photogrammetry system for half the cost of what most systems are selling for now. I don't understand why anybody would buy anything else from here on out. I really do think that this scanner is going to take over the market, for sure.